This powerful passage in Mark brings together two very different people. Jairus, a respected leader, and a nameless woman who had been silently suffering for 12 years. Despite their differences in status and circumstance, they both come to Jesus with desperate faith, believing he is their only hope. Jairus' request is urgent. His daughter is dying. Yet even in the rush, Jesus stops for someone others would overlook. The woman considered unclean and likely rejected by society reaches out in quiet faith, believing that just touching his robe would heal her. And it does. Jesus doesn't let her healing remain anonymous. He calls her out, not to shame her, but to affirm her. Daughter, your faith has healed you. In that moment, she isn't just healed physically, she's restored emotionally and spiritually too. While Jesus is speaking, news arrives that Jairus' daughter has died. Can you imagine the heartbreak Jairus must have felt? He may have wondered if the delay cost his daughter's life. But Jesus turns to him and says something deeply profound. Don't be afraid, just believe. These words are a call to trust beyond what we see or understand. When Jesus rises Jairus' daughter from the dead, it becomes clear. No situation is too far gone for God. This story teaches us that faith is not always loud or perfect, but it is powerful. Sometimes it looks like crying out in front of a crowd, and sometimes it looks like a trembling touch in secret. As we reflected on this passage, we asked ourselves, where do I need to reach out in faith today? Am I willing to trust Jesus even when the situation looks hopeless? Do I believe that he sees, stops for us, and cares about even in the quietest cries? Whether we feel like Jairus or the unnamed woman, Jesus meets us in our fear, honors our faith, and restores what is broken with compassion and power. In this story, both Jairus and the sick woman show bravery by being open about needing help. Jairus was an important man, but he got down in front of Jesus and begged for help for his daughter. That took a lot of courage. The woman who had been sick for 12 years wasn't even supposed to be in the crowd, but she took a chance and touched Jesus' clothes, hoping to be healed. Both of them were willing to risk embarrassment or judgment because they believed Jesus could help, and that is courageous vulnerability. Even though Jesus is the one doing the miracles, other people are a part of the story too. Jairus asked Jesus to come with him, and the woman reached out first. Jesus didn't act alone. He included his disciples and the girl's parents too. This shows that healing and good things often happen when people work together and trust each other, and that is collaboration. Jesus is a great example of a kind and humble leader. Even though he was on his way to help Jairus' daughter, he stopped to talk to the woman who touched him. He wasn't in a hurry, and he made sure everyone felt seen and loved. When people told Jairus his daughter was dead, Jesus encouraged them to keep believing. He led with calm, love, and strength, even in tough moments. And that is a big leadership. Jesus showed deep kindness and care to everyone in this story. He didn't just heal the woman, he called her daughter, which made her feel accepted and valued. He gently brought Jairus' daughter back to life and asked the family to keep it quiet. Jesus cared for people no matter who they were or what others thought of them. His love went beyond what people expected. So, in simple terms, be brave and ask for help when you need it. Work together, healing doesn't happen alone. Lead by being kind and steady. Love people, especially the ones others forget. This story is full of simple but powerful lessons about how to care for others and be there for them in a real honest ways.
In the reading, courageous vulnerability stands out in the way both Jairus and the bleeding woman reach out to Jesus. Their action required them to risk rejection, social shame, and heartbreak, but they did it anyway. Jairus, a respected synagogue leader, puts aside pride and status to fall at the feet of Jesus and beg for help. That kind of humility does not come easy, especially in a role where you're expected to have all the answers and maintain control. I think about how often people in leadership or even in daily life struggle to admit the need or show emotion. But here, Jairus leans into his vulnerability and does so publicly for the sake of love. Now, the woman with the bleeding disorder embodies this concept even more intensely, because for 12 years she had been isolated and considered unclean, which likely exhausted her condition and the failed efforts to fix it. And yet she believes that just by touching Jesus' cloak might heal her. She moves through the crowd, knowing what people might say or do if they notice her, but she did not care. That kind of vulnerability takes strength. It reminds me of the philosophical idea of the leap of faith. Not just belief without evidence, but trust that requires you to step out into the unknown, into risk, with your whole heart. Continuing on and knowing what meets their vulnerability is uncommon compassion. Jesus doesn't just heal them and move on. He stops, he asks questions, and he listens. With the woman, he lets her tell her whole story, something most people probably avoid or dismissed for years. He restores not only her health, but her dignity. Now, with Jairus' daughter, even when others say it's too late, Jesus keeps going. He's not swayed by the laughter or the disbelief around him. That's not new to him. That's compassion that isn't performative or convenient. It's a patient, personal, and it's radical. Philosophically, this passage reflects an ethic of care that prioritizes the person over social norms or efficiency, even. It makes me think about how easy it is in the modern life to overlook someone's pain just because it's inconvenient or uncomfortable, or you just simply don't know how to relate to it. But true compassion, what I'd call uncommon compassion, isn't transactional. It sees people in their fullness, even when they're at their lowest. In my own life, I learned that vulnerability and compassion often go hand in hand. It's hard to truly see someone else if I haven't first allowed myself to be seen, honestly and humbly. This passage challenges me to show up with that kind of openness and care, especially when it's hard or when others might not understand it. Now, as I reflect on Mark 5:21 through 43, I see a clear mirror of the caregiving philosophy I've begun to shape for myself, one that places human dignity and emotional safety at the center of healing. In both Jairus' plea for his daughter and the quiet desperation of the bleeding woman, I hear the same unspoken message that patients often send. Please keep me safe. It's more than physical protection. It's a request to be seen, heard, and held in their most fragile state without being judged and without being dismissed. When the bleeding woman reaches out to touch Jesus, she does so with a mixture of faith and fear. She has been suffering for years, physically, socially, emotionally, and yet in that moment, she chooses to believe that she is worthy of healing. What Jesus does next affirms everything I hope to embody in my own practice. He stops, he turns, and listens. He doesn't just cure her, he calls her daughter. The one word offers not just physical relief, but restoration of her identity, her dignity, and her sense of belonging back to the community. It's a moment of deep emotional and psychological safety. Exactly what keep me safe means to me. Healing in that moment comes not just from power, but from being present. Later in the passage, when Jairus learns that his daughter has died, everyone assumes it's too late. But Jesus presses on. He doesn't let the fear or doubt of the crowd steer his steps. This is leadership in its truest form. Staying steady in the storm, showing up when it's hardest, and carrying the burden of hope when others have let it go. That reminds me of the quote from Gates of Fire, "A king does not abide within his tent." Jesus leads by walking with the hurting, not above them. That kind of philosophy and leadership is what I want to live out. not based on authority, but rooted in service. The compassion and strength Jesus models in this story reinforces everything I've come to believe through this course, that caregiving is, quite frankly, a privilege, not just a profession. I want my patients to feel safe enough to be vulnerable with me. I want to listen fully, respond with dignity, and lead from beside them, not ahead of them. Just as the bleeding woman was restored by being seen and Jairus' daughter was lifted through faith and follow through, I hope to offer the same kind of healing, not always through medicine alone, but through presence, courage, and care.
The reading that we think goes well with our story from Mark 5 would be conscious and courage. The story of the woman who doesn't think twice about taking in a young Jewish girl during World War II and treating the girl as one of her own. This reading mentions that the woman helped the child on impulse, but when we really break it down, she was doing this out of the kindness of her own heart, which was instilled in her for a very long time due to her faith in God. So really, it just came naturally to her. It wasn't that it was just impulse. Her husband later comes home and is very scared and asks his wife, well, what about our children? Couldn't this put them in danger? And she responds with the story of the Good Samaritan, saying she doesn't want to be like the first two travelers from that story who turned their backs on someone in need. This is exactly what Jesus does in our story by helping the woman who has been suffering for 12 years and by bringing this young child back from the dead. Without hesitation, Jesus always serves others and does it out of kindness and compassion. Much like the woman who took in the Jewish child and then later went on to shelter hundreds of other individuals during the war. Both are stories of pure compassion and of helping others. We can take encouragement from her words about the Good Samaritan, especially in healthcare. All patients deserve to be helped and given kindness, and we can never turn our backs on a patient who is in need. This would be unethical and just inhumane. Conscious and courage is the perfect example for how we should carry ourselves in the medical field. Okay. Everyone in this class that has read any of my discussions knows that I love to talk about the Taj Hotel, so I have to talk about it again here. During the Taj Hotel attacks, staff members, despite being absolutely terrified, chose to stay and help guests escape. They didn't run. They remained present, even though they were in danger, to serve and save others. In Mark 5, Jesus, surrounded by pressing crowds and urgent needs, remains present as well. He stops for a bleeding woman. He walks with a desperate father. Even when people say the little girl is dead, he keeps going. The staff at the Taj didn't know what would happen next, but they acted in courage, not because they had no fear, but because they loved beyond fear. The woman in Mark 5 was also afraid. She wasn't even supposed to be in public, yet she pushed through the crowd to reach Jesus. Jairus, a synagogue leader, humbles himself publicly before Jesus. Both face fear with faith. Some of the most powerful stories from the Taj were about human touch, people guiding each other through smoke, shielding strangers, or whispering words of hope. In Mark 5, healing happens when the woman touches Jesus' cloak and when Jesus takes the girl's hand and says, Talitha kum. The world said that the girl was dead. The woman had been bleeding for 12 years, her hope exhausted. Similarly, at the Taj, many were trapped with no seeming way out. Yet rescue came, and in Mark 5, Jesus restores both women, one from the edge of death and the other from years of suffering.